How to treat a narcissist. Accepting that you might be a narcissist and need help is a major challenge, but doing so may improve your relationships and overall happiness. If this is the case for you, you must be willing to admit there's an issue, seek a professional diagnosis, and embrace a rigorous psychotherapy plan. If, instead, you're looking for help with identifying and dealing with or even living with a narcissist, whether or not they've been diagnosed with NPD, narcissistic personality disorder, understanding the challenges of treating narcissism can be helpful. 1. Accepting that you need help. Don't ignore feelings of depression or discontent or self-destructive behaviors. You'll probably never say to yourself, "I think I have narcissistic personality disorder. I should get help for that." Rather, if you do choose to seek help, it's likely because you're concerned about impacts you don't see as connected to narcissism, things like feeling anxious or depressed, an inability to sustain relationships, or self-destructive behaviors. If you feel that something's missing or isn't quite right with your life, talk to your doctor and, if recommended, get a referral to a mental health specialist. Narcissists find it extremely difficult to admit that anything is wrong with them, so this is definitely a difficult first step to take. 2. Take an honest look at how other people perceive you. Take an honest look at how other people perceive you. You probably tend to see the criticism, constructive or otherwise, of others as evidence of their shortcomings, and don't want to admit any of the criticism could be valid. However, try very hard to look at things from others' perspectives and see how your behaviors may contribute to their views. If people often tell you that you're self-absorbed, have a sense of entitlement or an inflated ego, or that you lack empathy, fight your impulse to discard these views as jealousy or ignorance. If you can admit to yourself that there may be even a little bit of validity to these views, you may be able to summon the strength to seek treatment. 3. Ask yourself if you're willing to challenge your sense of self. Accepting that you're a narcissist is very difficult, and treating it may be even more challenging. After all, you have to be willing to let go of fundamental aspects of your self-perception and replace them with a more balanced sense of self that can accept shortcomings and imperfections. Some experts question whether it's truly even possible to effectively treat NPD. At the very least, it's clear that treatment requires a full commitment on both the patient's and the therapist's parts. There's no magic pill, or any type of medication, that can cure narcissism, nor any other type of quick fix. You'll probably have to embrace regular, ongoing therapy with a trained mental health professional. 4. Seek the support of loved ones. You may have a history of pushing loved ones away due to your tendencies towards self-absorption and lack of empathy. However, in order to get the help you need and stick with it, you'll require the support of as many caring people as possible. Though it will be a very difficult admission to make, tell them that you know there's a problem and you are trying to get help. If they offer to help you by finding potential therapists, driving you to appointments, or providing moral support, fight your urge to reject them is out of hand. 5. Getting a professional diagnosis. Visit your doctor for an exam and possible referral. Make an appointment with your primary care physician and give a general explanation of your concern, something like, "I've been feeling depressed a lot lately," or, "I don't understand why I can't sustain friendships or romantic relationships." The doctor will likely start by giving you a physical exam, to check for any physical issues that might be affecting your emotional health. They'll also probably ask you more about the symptoms you're dealing with, and try to get a clearer overall picture of your mental health. They may also ask about your childhood and your parents, as well as any family history of diagnosed mental health issues, as these may contribute to NPD. If they suspect NPD or another mental health issue, they'll probably refer you to an expert in that field. 6. Undergo a psychological evaluation by a trained expert. It's hard enough, as someone with narcissistic traits, to go to a regular doctor and admit there might be a problem. It's even more difficult to admit the same to a specialist. Fight your urge to say that everyone is wrong about you and incompetent, and go to the appointment. The expert will start by asking for more details about your symptoms, upbringing, and so forth, and may give you a verbal or written questionnaire to complete. Thank you for watching, and please don't forget to hit the subscribe button for more videos.